Thanks for tuning in to this week's union update. This one's for the week of Monday, May 18th. I'm Jana Blunt, your chapter president and your host. Here's the agenda. First section is all about quick info. This Wednesday's Worksite meeting, free testing for COVID-19, our staff development fund deadlines coming up, vote by mail ballot tracking, and then today, this Monday's North Coast Member Town Hall. Middle section is going to be all about the meet and confer that we just had with HR. Was going to go over our 5 proposals. The first was compensation for frontline workers. The second, lifting the vacation accrual cap. The third is for disaster pay extension, telework expansion after that, and then lastly, our involvement in re-entry procedures. The third and probably heftiest section of this particular video is all about re-entry. I'm going to talk a bit about the Board of Supervisors decisions lately, some issues that have come up between EFMLEA versus Childcare, a checklist that was issued by the county on re-entry, all about the health screening app that we're supposed to download, and let's do it. So the countywide worksite meeting, just as a reminder, is this Wednesday. It's a lunchtime meeting. It lasts an hour from noon to 1. I'll be hosting, and please just tune in. The invitation's going to be going out via email today or tomorrow. It's just come in and receive updates, ask questions, voice concerns, say what's up. It'd be nice to meet you all. Again, this Wednesday, the 20th. Information about COVID-19 testing. It's a drive-through testing. We all qualify to get it for free, regardless of whether or not we have symptoms. There are appointments available, and all you have to do is call the phone number in the middle of your screen there. It's extension 4667 or 565-4667. It's really quick. It's important to get tested because it helps us reopen. It also allows us to track cases. I got my test last week. It's a bit uncomfortable, but it's quick, and the people were actually really nice. If you know where the old Sutter Hospital used to be on Shenate, once you start going up Shenate, it's on the left-hand side at the light. That's exactly where the testing is. So please call extension 4667 to make your appointment. And if you know anyone in your life who happen to be healthcare workers, first responders, or anyone who's considered an essential worker, please have them call as well. It's free to all of us. The staff development deadline is really coming up soon here. We only have a few weeks left. We need to submit them ASAP. We've got until June 30th, but I do not recommend waiting that long just in case there's any hiccups. So make sure that it's for a receipt that's dated July 1st of last year to June 30th of this year. You just select the top option on the eForms page, and this contact information is who you want to holler at if you have any questions. It's extension 3900 or just staffdev@sonoma-county.org. Again, get a hold of them as soon as you can if you have any questions. So ballot tracking information I got from our elected official. Anyone who is a registered voter will be getting a vote by mail ballot in November. Please re-register to vote if you're not sure whether or not you're registered, especially if you've moved or if you haven't voted in a while. We've rolled out a new tracking system for ballots statewide, and you can sign up to track your ballot here. where'smyballot.sos.ca.gov. This link and all other links will be in the description area for the video. I did it myself. It was extremely quick. You can sign up to get text, email, or voicemail messages regarding your status, and it's pretty much from beginning to end. You can determine where your ballot is and what its status is. All right. So on Monday, which will probably be today if you're watching this on Monday, there's a member town hall. It's via Zoom, and it's from 12 to 1. This is not for this chapter, it's for our entire region. And so SEIU leadership is going to be giving us updates on proposals, side letters, PPE information, reopening information, and just general communications. I'll be putting forth some information in the meeting myself. It's going to be a short presentation on what's going on for Sonoma County chapter. We are by far the largest chapter in this region, so they're going to give me a little bit of time to give some updates. So obviously you can't click the link in the lower left-hand side because it's just a screen cap, but you should have received an email about this in the last few business days. So take a look, do a search in your email inbox for Town Hall, and you should be able to find it. Hope to see you there. All right, so here's the middle section. Let's go into the meet and confer. We put forward 5 proposals last Thursday. The first was for our vacation and comp time accrual. Second is compensation for frontline workers. Third is continued disaster pay not work status. Fourth is options for telework. And then the fifth is the safe return to the workplace. So I'll go into what that all means. So the first one, vacation and compensatory time accrual, compensatory, I can never pronounce it. This is an accrual cap lift for vacation and comp time. It would be a temporary lift. It would be retroactive to the 1st of April of this year. The point of it is to prevent accrual loss. There are over 300 people who are within 60 hours of their accrual cap, and over 130 people who are within 10 hours of it. So anyone who exceeds their cap would have until the end of next year to use those accruals. So that's what the proposal generally is. The second proposal, compensation for frontline workers. This would be 8 hours of special comp time per 40 hours worked. This comp time would be in a separate bank from your regular comp time to prevent an issue of meeting the accrual cap. Anyone who is performing duties, whether it's because of their job classification or because of the assignment that they're working, if they've got direct public contact, then that would apply. And this would be applicable from 4/1/20 through the duration of the public health order, however long that lasts. So that is the proposal that we put forth. The third proposal that we gave the county was continued disaster paid not work status. So there actually are some workers whose assignments don't allow them to telework and that they're restricted from physically returning to work. So it would continue that status for the duration of the public health order for these people. Anybody without an accessible work site or the option to telework, it would allow them to remain paid. There's technically not an expiration date on that right now, but the county's been looking at one and we don't want that to happen. Our fourth proposal that we put forth was an extension and expansion of telework options. It would extend it into the fall and winter of this year, and that includes beyond this public emergency, as long as the CDC recommends social distancing. We chose the CDC because they tend to be the most conservative about public health. And then lastly, our safe return to the workplace. What this means is that we want to remain collaborative with the county. We want to have involvement. We want to continue negotiations. It would be countywide as well as for each department. Okay, so let's go into the reentry roundup. This is going to be the biggest section of this video, and I'll try to get through it quickly. So the state of California has benchmarks that permit accelerated reopening, so long as a county has less than 1 coronavirus case per 10,000 residents. And I'll go into what that means for us in a moment. It also means that that county would have to have no deaths in the prior 2 weeks of any given time. The Board of Supervisors has been pummeled by local business leaders to get everything reopened. And Dr. Mase has received all sorts of threats and insults from business owners. Some of those threats have been pretty frightening, and a lot of the insults have to do with her gender and her ethnicity, which is really classy. Our Board of Supervisors are going to be asking the state to reopen in spite of Dr. Mase saying it's a bad idea, despite the fact that we are not qualified due to our particular caseload and the death toll in this particular county. According to Shirley Zane, the state criteria doesn't make sense. She thinks that the bar is too high. David Rabbit says, yeah, we don't really have a good case or a good argument on deaths, but we definitely have a good argument on cases. So as soon as the gates open, we need to be off. So the requirement would be fewer than 50 new confirmed cases in 2 weeks. We're at double that. And then without any deaths in the past 2 weeks, we're failing that because the last 2 of our deaths have occurred in that period of time. So Dr. Mase has made it clear that she doesn't think we're ready to reopen. She really wants everyone to increase their amount of caution. And she's warned us clearly that if we do reopen, we're going to get a greater spread of coronavirus. It will increase. She's not the only one who's saying this. Dr. Cody in Santa Clara County, who's pretty much been at the forefront of the shelter orders in the Bay Area, has urged her particular board of supervisors to hold off. She said specifically, we're not there yet, the conditions haven't changed, we don't have a vaccine, and nothing has changed since March. If we did ease up, we will see a brisk return of cases, of hospitalizations, and a brisk return of deaths, to be quite blunt. So we would also, if the state were to allow us to reopen early, it would be because we were able to provide letters of support from local hospitals, and that's not been achieved just yet. So the supervisors have been unanimous in this push. Linda Hopkins has said, quote, that we're not advocating for the sacrifice of our public health for the economy. They're looking at an economic collapse that would be worse than the Great Depression. David Rabbit says, regardless of what happens, he'd like to get the waiver put through, even if it's denied, in order to be able to make the point that the Depression is a reality. So there's two arguments here, or at least there is on the surface. Most of us are saying this is highly irresponsible. We're not ready to reopen based on the public health requirements. On the other hand, people are saying, well, unemployment is through the roof. Both things are correct. County officials have a responsibility to solve these issues while following the public health order. It's their job. At the same time, our local businesses are closing down. We're not talking about Applebee's or TGI Fridays. We're talking about the whole pie. We're talking about our favorite taqueria. We're still without adequate PPE at each of our healthcare sites. Not only is Kaiser still without them, but many clinics don't have enough either. At the same time, people can't afford to pay their rent. There's potential evictions. People can't afford to pay their mortgages. In our Latinx community, which is over a quarter of our population, because of socioeconomic problems, there are 4 times higher to become infected. And then because of the fact that our county's median age is older than the state and national average, that increases our vulnerability as well. At the same time, yeah, we probably are headed for an economic collapse. But there's more to it than just this. We've had insufficient testing. We've had very poor tracking. And we may have slowed deaths, but they're not stopped just yet. We have a broken political system. There's no good options at the current rate. We don't have the social and economic support that we need. Our infrastructure is garbage. While there's no correct sides to the argument, the most important thing to realize is that the real solution that we have is based on the support that we don't have. We cannot separate our physical well-being and our economic well-being. They're completely intertwined. If we're more concerned with becoming politically pure on either side of the aisle, so long as we're afraid to discuss it because it's quote unquote political, and so long as we can't put the need of others before the needs of ourselves and our own families, we're screwed. Keep that in mind. If you remember from the last video, HPEACE, which is a group of doctors, nurses, and other healthcare officials, they've got the change.org petition in order to ensure that all healthcare facilities in the county has adequate PPE. They're making their point known. Again, these are doctors, these are nurses. They've said point blank, it is not safe to reopen yet. Our testing is not sufficient. We have clear health inequity. Because of the fact that Latino communities 4.5 times higher risk, that's not good. They're going to have a higher vulnerability, and it's going to mean sickness and death. If we make this decision, we need to acknowledge what's going to happen, and we need to take responsibility for what's going to happen. In the email that they sent, they remind everyone that we should be attending Tuesday's Board of Supervisors meeting. Go to the Board of Supervisors calendar and hook up. You have the ability to submit comments. I think it's really important that as many of us reach out to the board as possible. It would be for the best. I haven't gotten permission to quote her, so I'm not going to, but these are not my words. This is the words of a member that I hold in very high esteem. She said that the board's unanimously undermining the hard work that we've done to teach our community about how to operate during a pandemic. We will be making casualties of our most vulnerable if we reopen too quickly. Of course, people are impatient about staying at home. For some, they've never been able to stay home. But without being able to come together to push for federal funding for states and localities, to ensure that unemployment payments are continued, to ensure people have rent relief, monthly payments to households, and without involving leaders of marginalized communities and healthcare professionals in decision-making, until we're able to do all of that, we're not going to have a public health response of any appropriateness, and we're not going to be able to safely reopen. Please email your supervisor. Figure out what district you're in. Here are their email addresses. Email all 5 of them, but if you're going to email any of them, please email your own because they're required to listen to their constituents. All right, here's our third section. We've had some members come forth forwarding some problematic emails in regards to managers pressuring them to apply for childcare before they apply for EFMLEA. Please remember that whether or not you stay home with your child using the EFMLEA time while they're required to be home due to their childcare, their care facility, or their school being closed due to the coronavirus, this is your decision to make, not your manager's. Qualifying for EFMLEA does not include the requirement to attempt placing your child in daycare. Doing that and then failing is not something that you're required to do before you apply. Don't forget, you have up to 12 weeks of leave under this act. The first 2 weeks are a grace period that you can use your emergency paid sick leave on, but you can be out up to 12 weeks in order to make sure your children are cared for. You can use these hours intermittently, which means partial days on and off, and it's 2/3 of your wages. That remaining 1/3 would be your responsibility to pay using EPSL first because it does expire at the end of the year. You've got 80 of those hours if you haven't used any of them. Then your accrued sick, vacation, and comp time is what you'd want to use. If you have children and they're home and there's no place for them to go and no one to care for them, you qualify. It is not required that you send them to childcare. If you have any questions or you want to apply, talk to your own payroll team. If you don't know who they are, let me know and we'll figure out who that is. I wanted to just briefly show everybody this gigantic packet that the county HR is distributing to management at each department. It's a checklist with directions, instructions, all in relation to the re-entry procedures. This is kind of hitting us full speed. Just in the past few days, all of a sudden re-entry is this giant reality that's looming upon all of us. And it's been a bit overwhelming. I'm not sure when I personally was expecting it, but I don't think it was this soon. I clearly was in some sort of denial, which is not a first. Here's the table of contents. In general, this packet contains a checklist that each department manager must complete. In it, they must provide an evaluation of their own employees' COVID exposure risk. They must acknowledge and indicate how they're going to minimize in-person interactions. They are required to monitor our health. I will get into that shortly. And then they've got requirements to make physical adjustments if necessary to lessen risk of infection. So I just wanted to show you the pages, and of course I'll explain how you can get a hold of this packet as well. Just wanted to show you, here's that first section. That's that evaluation on how exposed we are. There's different levels of what they call exposure risk: low, medium, high, very high. The second section in the middle there gives opportunities to minimize interactions in person, and they're required to check the box when it comes to what their particular department or agency has achieved. And then the third section in this first part talks about the daily monitoring. It mentions the application for your phone, which again, I will get to in a moment, and talks about the different mitigation measures. The second section here is a detailed explanation of what each of those risk levels are: lower exposure, medium exposure, high, and very high. It seems that the high and very high are kind of reserved just for healthcare scenarios, healthcare environments. So I'm going to go ahead and assume that unless you work in a facility that is providing some sort of healthcare, that your department management is going to consider you either lower or medium exposure risk. I hope I'm wrong, but I can see that. The next section talks about all the general prevention measures that we've seen a million times. Don't touch your face, wash your hands, yada, yada. It's got a section on what employees should do, what our visitors should do if we're ever open again, face covering information, PPE, and then what they call best practice recommendations. That includes implementing flexible work rules, so continuing telework, job rotation, flexing work hours like staggering shifts, things like that, increasing physical space, downsizing, yikes, things like that. The next section gives you kind of a physical explanation of what needs to be done in the office. The lobbies, interview rooms, field work, surface cleaning, carpooling. It kind of gives a brief explanation of how people should be seated at workstations. There's some cubicles that are kind of being rearranged and people are being faced in other directions. It'd be really nice to get an update on each physical location as to what's being done. We've got folks reporting in from lots of work sites, but not all. So let us know what's being done in yours. In the last section, talks about the actual phone app again and what the health screening is going to look like when it comes to walking into the work site. And I'm going to get to that in the next screen specifically. So starting this Wednesday, everyone who's entering a county facility as staff has to participate in a self-assessment and has to have their temperature taken before reporting to work. Here's the procedure. There's a phone app that the county paid IBM to develop. It's a requirement to check for symptoms, and it's a requirement that employees are verified to be in good health before they report to work. We're being asked to download this app and to conduct our own self-assessment each day prior to beginning work. If for some reason an employee doesn't have an Apple or Android phone, their alternatives are to either go to the SoCo emergency website to perform the check or complete the employee wellness check protocol with their employer at their work site beginning work. So prior to arrival at the work site, again, you would do a self-assessment of your own health and you would call in sick to work if you have any of the symptoms listed on the app. And again, I'm going to show you what the app looks like in a second. Prior to entering your work facility, the manager or supervisor is required to determine whether or not you've completed a wellness check. And if you don't have the app, you're supposed to ask your staff if they've experienced any of the symptoms on the app. They want management to limit the number of entry points. They want there to be like an actual screening area. They want employees to maintain space while they're waiting to do so, even staggering start times if necessary so it doesn't bottleneck. Again, the SoCo COVID-19 wellness check log is what they want to be used for each employee to be confirmed screened. The log does not record any symptoms or temperatures. It's just a checklist, I suppose. If any employee refuses to participate in any part of this process, it's required that they're sent home. The employee at this point will indicate whether or not they've had contact with someone who has COVID. If they do, it's obvious what's going to happen. It's the same as now. They're supposed to go and talk to their doctor. The employee is asked about whether or not they've experienced symptoms. And then the manager is required to take the employee's temperature to confirm that it's not above 100 degrees Fahrenheit. If for some reason it's at or above that, the employee should be sent home. And then this is also a time where management's supposed to ensure that employees have an appropriate face covering. They're also required to provide one if staff arrives to work without one. So as before, if anyone develops any symptoms during the day, they're required to go home after notifying their supervisor. So I downloaded this app over the weekend to check out what the heck was going on. I do not have an iPhone. I do not like iPhones, but I do have an Android phone, a Samsung, so this will hopefully look similar to the Apple app. I can't imagine it looking much different. So here's what it looked like when I went to the Google Play Store. It's called SoCo COVID-19 Check, and I took screenshots of all this stuff. So here's the images that popped up. Again, you see that IBM's in the bottom left there, and it shows you some screenshots. And then underneath those screenshots, there's a blurb that talks about the app a little bit. And I wanted to just point out the second section here. It says that there's no way that they're being provided with our personally identifiable information, like our name, our location, our job title, or department. Our location is not tracked and it's not asked for. So here's the actual screenshots from my phone. After I downloaded it, this is the first thing that came up. It was a privacy policy. It's not very exciting until you get to the information sharing section, and it goes ahead and says once again, no information is collected or stored that has to do with you as a person individually. It doesn't track your location. It tells you what you are asked, and then that's the rest of the privacy policy. It seems to cut itself off where it says, this app doesn't give medical advice. If you need it, contact your healthcare. And I'm assuming it's supposed to end in provider, but that's as far as it goes. If you click I understand, it'll take you to the little home screen, which is what it looks like right here. When you click on next, it takes you right to the first screening survey. But I didn't take the survey immediately. I did click the back button just to see where I'd go, and it took me to the main screen, which is kind of like a feed. I'm in the feed section here, as you can see toward the bottom there, and there's a second section that's called My Care. And when you click on My Care, this is what it looks like. It gives you the opportunity to take the wellness check, and then underneath it's for management to verify employees. I couldn't get very far there for obvious reasons. You have to enter in codes. So again, you've got a dashboard for a feed or My Care. And underneath where it says in the third photo here from the left, where it says your source of community info about COVID-19, and it has that map. If you start to scroll down, you'll see things like press releases and videos from our health officer. So it's kind of just gives you updates on what's going on. So I went back into the survey and decided I'd take one. So the first thing it asks you, if any of these crazy things are happening, are your lips blue? Are you having trouble breathing? If you say no to this stuff, if you click that you do not have the symptoms, here's where it takes you. There's 4 sections of the survey. The first one, it asks what industry you work in, because again, this is not just for us. Apparently they want to roll this out to everyone in the county. So I put the zip code where I worked. Many of us will have the same zip code. And then the industry, it gives you a bunch of different options. When you scroll down, I just chose government at the very bottom there, and I clicked next. And then it asked me what my age was. And again, they're just saying, hey, are you a minor? Are you an adult? Or are you an adult 65 or older? And so I chose, and then I clicked next. Took me to the third of 4 sections, contact. Have you been in contact with anyone confirmed to have COVID in the last day? I chose no. Clicked next, and then it asked me whether or not I experienced any of these related symptoms. And here's the symptoms that they give you. Those are the different options. And so thankfully I clicked on none of the above, and I clicked submit. And this is the splash screen that comes up afterward. It says to share it with your employer, but it lasted about 1 second before it went away. actually had to go back in and retake the survey just to be able to screen cap this, because I'm assuming this is what I'm going to be having to show my supervisor when I get to work. I don't know, but that's what it looks like. This is what happened when I was unable to cap it quick enough. You have the option to just update your wellness check at any point, so you can make changes to your answers and resubmit. And so this is what it looks like in your My Care section after you've taken your daily wellness check. So this is the phone app. It's going to be up to you as to whether or not you download it. You do know what your alternatives are going to be if you don't. I'm not going to try to editorialize too much here, but my initial reaction to all of this was not excitement, at least not in a positive way. After I've read into it a little more and I, gave it a little bit of time, and then I took it, obviously, after downloading it, I'm personally not too concerned, but this is an individual decision each of us is going to have to make. And, it's definitely not the union's job or union leadership's job to tell you what to do. It's going to be up to you. So just remember that if you don't download the app, then you'll have alternate means, and your management will tell you more about that. Don't forget that everything that I saw is what you saw. There was no opportunity to provide who I was, where I lived, what my job title was. It was very generic. Even the age ranges, 18 to 64, that narrows it down. So just keep that in mind. You got through it. I just wanted to remind everyone that if you haven't already, please go to socounitedincrisis.org, sign your name to the platform that ensures that we demand a community safety net for everyone. And then if you haven't already gone to HPEACE's public health order petition, I will share the link in the description area. This is to ensure that there's PPE available for all of the Sonoma County health workers. And as always, if you haven't already, and I'd be surprised because we've got hundreds of people who've signed up, so very nice. But if you haven't already, please go to the bit.ly link here or look at it in the description area. This is for real-time emails, text updates. These are quickest release, and they are unofficial. So just in addition to the official email blasts and the Facebook page updates, this is just a third opportunity for you. So thanks again to everyone for watching, and you know how to get a hold of me, Jana Blunt, SCIU@gmail.com, if you ever have any questions. Hang in there.